So today's presenter, Dr. Carol McKinley Alvarez.
Good morning, everyone. I am Dr. Carol McKinley Alvarez. I go by abbreviated Dr. Carol. Very nice to meet all of you today. We are going to have some fun and talk about unconscious bias, something that we all have, whether we recognize it or not. I tend to say all the time that the work that all of you do, the work that we all do, is work that is heart work, HEART, and it makes it hard work, HARD. And sometimes we think because we do hard work and that we're caring people and social advocates, et cetera, that we don't have biases. And unfortunately, our lived experiences creates bias. And that's why we have the conversation so that we're more mindful about how those biases might show up. I've been doing consulting work where I talk about diversity, equity, inclusion, access, and belonging before those letters became popular. And so I've been doing it for over 25 years. I am a consultant for execs in both for-profits and nonprofit organizations. And then I'm also a chief program officer slash clinic officer for a local nonprofit organization. So I'm excited to be here today. I used to be the chair of the Contra Costa County Mental Health Board or Mental Health Commission. We called ours a commission, and was on that commission for 5 years. So this work, these conversations are really near and dear to my heart. I'm going to jump us in because we only have so much time. So our objectives for today is that we are going to be able to hopefully at the end be able to define what is unconscious bias. You'll be able to identify unconscious bias in service delivery, which is crucial. You'll be able to define and give examples of microaggressions, and then you'll also be able to identify strategies to address unconscious biases, both within you and also when you may see them manifest in people that you're working with, your co-collaborators. Typically, I have people read all of this, so I'm not talking so much, but I'm going to be reading. But I also ask you to let your eyes go ahead and peruse this particular quote. But bias is an inclination or prejudice for or against one person or a group. And in other words, our unconscious biases are unconscious feelings that we have towards other people. And these feelings play a strong part in influencing our judgment of certain people and groups away from being what we tend to call balanced and even-handed in many different areas of our lives. And I really like this particular quote because sometimes people explore what is unconscious? How is it unconscious? And the way in which it's unconscious, this particular definition helps us understand, is because there's something that happens on a conscious level, but it activates feelings that don't quite align with why we are thinking one thing and feeling another. And so it is where you may be walking somewhere and all of a sudden you feel the need to cross the street, or you feel the need to hold your belongings a little closer to you and you're not quite sure what that's about. The example I typically give is if I'm talking with someone and I have my purse maybe like an arm length away from me and I'm not paying attention to my purse being over there. I'm engaged in great conversation and different people have walked back and forth, but all of a sudden I become very aware that my purse is not close to me when a certain person walks by. It's a feeling that comes up for me. It doesn't come up as a thought initially. It's a feeling that's activated that then moves me into a thought and moves me into behavior. And so when we're looking at these biases, the other thing that this definition points out is that it moves us away from this concept of being balanced or even-handed, which means for us that it either gives people more access to whatever it is, or it limits their access. That's what this concept is about being balanced and even-handed, because we don't live in a society that's balanced or even-handed. But this is really speaking to the fact that we can have biases that want us to do more for certain people. That is giving people more access, and we can have biases that restrict us, that make us not want to engage with them, which then means they have less access. Then the other piece of this unconscious bias is that it also is important for us to understand that it describes situations where our lived experiences, our backgrounds, our personal experiences, societal stereotypes, and cultural context impacts the decisions and actions that we have without us realizing it. It's not something that we're aware of. And so the question comes up, how many of us have unduly or unknowingly experienced or uh, perpetrated the negative forces of unconscious bias? How many of us have done that? How many of us have been perpetrators of unconscious bias? And the response is all of us. Every single one of us has done it, right? And it doesn't make us less of good people. It makes us knowledgeable that we need to be mindful of it, especially when we are designed to provide care. Psychologists, that's my world, and scientists, they've actually done studies about this. And this goes back to the point that I introduced myself in saying is that even if you firmly believe in equality, and I'm going to add in equity because equality and equity are two different things, it doesn't mean that you're not prone to bias. You are. It doesn't negate your humanity. You're still prone to bias. Bias, it's unavoidable, and bias permeates all aspects of our lives, everything that we do, including the way we show up in service delivery, which is why it's important that we talk about it. So now I'm going to jump into kind of why biases are in us. And there are two different things that comes up regarding why we are prone to have unconscious bias. And the first one is this concept around mental shortcuts, that we have five senses: our olfactory, which is smell; gustation for taste; tactile for touch; visual for sight; and auditory for hearing. We get information into those five senses. And as that information comes into us, our brain cannot keep up with the amount of sensory information that we are exposed to. So in order for our brain to not kind of go into overdrive, we are designed to make mental shortcuts. And these mental shortcuts are outlined based on our lived experiences. And so, for a lack of a better way of explaining it, our mind takes shortcuts. That means that we make guesses about things. And we do it without being aware that we're doing it. And so we have little narratives, little stories that are in our mind that have happened from our lived experiences as we've developed over time. These narratives shape how we view the world. So as things come in, we tend to connect to a narrative, and that becomes our truth about whatever it is that we're experiencing in that moment. Unfortunately, these mental shortcuts, which are designed to help us navigate the world, also unfortunately create fertile ground for biases because they're error prone. We're making incomplete pictures, but we believe that we're making complete pictures. And this is why it leads to bias. So one of the fertile grounds is mental shortcuts. We all do it. And the other one is social conditioning, the norms, the customs that we are exposed to. These all impact how we view the world. So it's from, as I said earlier, from the time in which we are conceived, technically, throughout our lived experiences, all of the things that we're exposed to, the communities that we're raised in, the things that we see, also the things that we don't see, the things that we are taught and the things that we aren't taught, our family, our friends, education, media, all of these things impact the lens in which we use to view the world, which therefore is called social conditioning and is the second layer of fertile ground for us to develop unconscious biases. And just think about what you've been exposed to in your lifetime and how it's shaped what you think is friendly, what you think is scary, all of the different plethora of ideas that come up in your mind, they're all rooted in the ways in which we've been conditioned. One of the things that I ask is for people to ask yourself this question, which is, what defines my perception? And when you ask yourself that question, I would let you know that the two things that defines your perception, which again is the lens that you use to view the world, are these two questions that's next to this slide. Who am I and what do I value? Though we're not going to actually wrestle with this right now, I am going to ask you to take a moment to jot down on a piece of paper, or if you're at a desk and you have a computer, to type, if someone was to ask you today, because this evolves every day, who am I? How would you respond? And you're going to be tempted to write down descriptors. I need you to unpack that descriptor. So for instance, one of the things that I say of who am I is that I am a mother. But what it means for me to be a mother and what it means for my sister to be a mother are two different things. But no one would know that unless I unpacked it. So go beyond descriptors and say, what does that descriptor mean to you? The other thing I'm going to ask you to do is to answer the who do I value, or not who do I value, what do I value? But I'm going to ask you also to unpack that and only list like two things you value, because some of us could list a laundry list of things we value. But why is this something that you value and where did it come from? So who am I? Go beyond a descriptor. What do I value? Why is this my value? And where did it come from? As humans, we've been taught to guess who people are based on the packages that we believe people are in, which is very challenging because it then pulls on our stereotypes about the packages that people are in, and it doesn't create the depth of who they are. And we end up also recognizing how limiting the boxes are that we've been taught to put ourselves in, but that we've also been taught to put other people in. And Zoom and the other platforms have been so poetic, right? Because we literally are in boxes, right? Well, rectangles, but we're in boxes. And so this exercise says, when we function from a box-like perspective, we invisibilize not only ourselves, but other people. That's considered othering. We other people by boxing them into who we believe they are based on our unconscious biases that we're not even typically completely aware of. And so this exercise pushes against that narrative. It pushes against our desire to keep boxing people in out of safety, out of security, out of trying to kind of figure out the unknown by creating a known. It's why I've heard people struggle with pronouns. Well, why do we have to talk about pronouns? It was so much easier when it was just she, he. That's it. They is not even linguistically correct, right? I've heard it all. And part of it is because we struggle with not being able to fall into a either or, a very dichotomous way of viewing things, about boxing people in that fit our perfect understanding of how things should be. Please hear me say again that in doing that, we invisibilize them and we invisibilize ourselves. And we create these unhealthy narratives that do not allow us to step into spaces and to challenge our unconscious bias. The thing about what do I value, the reason that I asked you to do that one was because our value system actually usually speaks to our unconscious bias. And our value systems typically are great. People are like, well, I value respect, or I value friendship, or I value family. They go on and on and on about the things that they value. But then when I ask people to unpack it, where did you get that from? What does that mean to you, et cetera? The definitions can be very different for two people who both value family. Some people say, well, I value family because that's where my root is, that's where my base is. And other people might say, I value family because of connectivity. Again, a diversity of ways of understanding this value system. But what I want to point out here is not just the diversity of understanding the value system, but I also want to point out that if you know what you value, that also is going to be a thoughtful place to unpack some of your biases. Because a person who comes in and for you, they don't appear to value family will be someone who you may potentially give less access to because they're going against something that you moralistically feel strong about. But if you don't identify these values, you do not recognize when you're more likely to pull away from certain people or to gravitate to others. Our value systems are important. All right, I'm going to keep going because I always get going and then I end up losing my time. So I'm going to keep pushing myself, and I apologize if I don't unpack some things that you'd like me to unpack more. There are a few ways that we have our unconscious bias. First one, anchoring. So I said how they come are fertile ground, mental shortcuts, and social conditioning. And then I wanted to let you know, in case you think you didn't have them, if you answer who am I and you answer what you value, woo, we have a moment of saying, oh yeah, I have some biases, because just in how I'm identifying myself shows these boxes that I've put myself and therefore other people in. Now I'm going to tell you 4 ways in which our unconscious biases show up. First one is anchoring. It's just like an anchor that may be on a boat or a ship. We know an anchor is designed to keep it from moving. Well, anchoring is the same here. But the concept of this is where we get one piece of information, and this definition says this first data point, right? And we may get it early in life or whenever it happens, but we get one data point. And then we make assumptions about people from that one data point. That has happened to all of us that are in this Zoom space right now, where people have one data point and then they've created a whole history for you without even getting to know you. Well, we do it. We all do it. And the problem about this is that we end up limiting our accuracy about who a person is because we're just using one data point. But the thing about anchoring is we become immovable in that. We're not willing to shift off of that first data point. And that first data point could be complimentary or it could be damaging, but we won't move off of that first data point, which leads to the next way in which we do it, which is attribute substitution. This is where we have the tendency to hear something about a person and then we substitute that with some kind of meaning. For instance, a person graduated from college and they graduated from a college that you really like. Oh, they must be highly intelligent and competent. Versus someone actually got their GED. Oh, they must have struggled really in school and they must not be that bright. Attribute substitution. We do it in all different ways, hearing something about a person and then making assumptions about that. And again, it can go in positive directions or negative directions, but when we do it, we actually are limiting our ability to truly understand a person. And we are giving some people more credit than others. Have you ever sat in situations where you actually hear something about a person, where they went to school or their background, or even right now, right? We have to introduce the speaker. They don't want you to be listening to a speaker who has no background. So when you introduce a speaker and they have a great background, then there's attribute substitution. You may then make assumptions that, wow, they're really competent. They know what they're talking about, and then be less likely to challenge some of the information that's coming. So we had anchoring. We had attribute substitution. Then we moved to confirmation bias. These go just hand in hand. So I have one data point. I make assumptions about you from that data point. I won't move away from that. That's anchoring. Then I hear something about you, and or I see something, right? It's not just here. Sometimes it's on paper when I have to work with HR departments. I'm like, did you score that person higher because they met some standard that you believe to be better? What was happening for you, right? But we have this attribute substitution, and then we have confirmation bias. Once I believe something about you, I just look for the things that affirm it. It's a domino effect. So you may be nothing like what I believe you are, but you are, because I have found evidence to support my ill-informed belief about you. And unfortunately, it's not based on quote unquote, this language that's here, reality. It's based on my reality, but it's not based on the real one. Confirmation bias. And this last one. This one can be a little confusing for people, but in the areas that are represented here in this Zoom, we all have individuals who have been impacted by homelessness. And notice my language. I am intentional about not saying the homeless, right? We don't recognize how we other objectify and invisibilize people by stating they are the totality of who they are is based on a lived experience, the schizophrenic, the homeless. And we even say it with some level of disdain when we usually say it. But here, I am intentionally speaking of people who are actively being impacted by homelessness. Now, we all have people who are in our communities who are being impacted by this. And the correspondence bias would be a way in which, instead of us seeing them as people whose lives are being impacted by homelessness, and the fact that we have gone through a pandemic and these numbers have quadrupled, and we are looking, instead of looking at a system and questioning the system of why is it that we live in one of the richest states and we have one of the highest levels of people living in this particular state, we blame them. They're lazy. They all have mental illnesses and substance problems. They choose not to want to be quote unquote housed. That word in itself kind of bothers me when we say people being housed, but that's a whole nother conversation for another day. We blame them. Correspondence bias is where we make the people inherently bad and responsible for societal issues. This is what happened when we were so easily able to cage children, because we said that their families, we made them the problem. And therefore, even though we have a system designed to keep children safe, justified caging certain ones, they became the problem. Correspondence bias makes it a personal failing on the person and removes it from a system's perspective. These are ways in which our unconscious biases show up. And with correspondence bias, it becomes so easy for us to other people and to create ways in which we have good people and bad people and locate all of the issues within them. Anchoring, attribute substitution, confirmation bias, and correspondence bias. Unconscious bias. And then when you get a chance, this particular dialogue that happens from this author is powerful because she talks about the danger of the single story. And this is where she says that we create singular narratives about people. And when we create singular narratives about people, we just treat them from that singular narrative. And we know that we have intersectionality, that we're more than just one aspect of ourselves. But when we walk around treating people that way, then this helps to continue the unconscious bias narrative. And that not only does it happen to us, but that we also do it to people. There is this concept of privilege, and Peggy McIntosh is really popular in talking about privilege. And her quote here is that privilege is an invisible package of unearned assets that I can count on cashing in each day, but about which I was meant to remain oblivious. This is such a powerful statement. Again, it's an invisible package of unearned assets that I can count on cashing in each day, about which I was meant to remain oblivious. One of the examples that I like to give is that prior to my father passing away, he went from being an able-bodied man to having some challenges, right? Some ways in which he had to walk a little slower because of just health things that happened. And I never recognized cracks on the sidewalk, lifts in the sidewalk, where there were doors that would automatically open, counters that were taller or shorter, um, places in which had ramps versus stairs, how far, how close, if we were at the airport, our gate would be. None of that. I never had to worry about that. That's called privilege. That's the invisible package of unearned assets that I cashed in on every day. That's what Peggy means here. That there are places in our lives where we have earned and unearned privilege. Unearned privilege are the things that you just come with, right? Unearned privilege is I am, quote unquote, this concept of able body, whatever that means for people. So it's a privilege that I have. I didn't ask to be this. I do some things to maintain it, which makes it also a earned privilege, but it's an unearned privilege. I speak English. It is what I have always known. That is an unearned privilege here. I identify as being heterosexual. That is an unearned privilege. I'm right-handed, if I need to break it down to some of you. That's an unearned privilege. And our lefties know it's an unearned privilege because if you're a lefty, you know that everything is set up for right-handed people, right? This is that concept. I came from a loving family. That's an unearned privilege. I didn't ask to come from a loving family. I just did. I have a body size and type that gets me things that I don't necessarily have to make sure I try on, or that I go to another department, or I need to have someone help fit it for me. I don't have to get an extra seat belt when I'm on the plane. That's an unearned privilege in my genetics. It's an earned privilege because of the things that I have access to do to be able to keep it. I just want to make sure you're following me. That it's not just the things that we write on a demographic sheet. Those things are important. What race you are, sexual orientation, all of those things are important, but it goes deeper than that. Because what we don't realize is that we cash in on them every day. I have a doctorate degree. That's an earned privilege because I worked for it, but it's on unearned privileges that I was able to get it. I came from a loving family, a family that valued education. I was able to prioritize my education. I was educated in a school system that put me on a trajectory to be able to be successful in college settings. Those are all unearned and earned privileges meshed together that lead me to having a doctorate degree. It's important for us to understand these because privileges create a level of impairment for us because we can come to believe that we worked hard for this. And it doesn't mean you didn't, but you also built it off of privileges. Also, privileges can have you invisibilize other people's challenges. If you don't know what it's like to have to check whether or not the community that you're going to go into actually value same-sex relationships, then you don't get it. And so in this piece, our unconscious biases can show up in our privilege. And then there's also places where we don't have privilege. That's the intersectionality of us. So in the places where we don't have privilege, if I go into my package, if you can see on the screen, I am African American. I identify as Black. That is who I am. And it is a privilege for me personally to be Black. But it's not a privilege in this society. And if you ever need to figure out what are the areas where there's not privilege, then you just go to the books to see, is there a law that actually gives people a right? Then you're more likely to realize that they don't have privilege. In my areas where I don't have privilege, I also, though, have to check to see maybe I have an advantage. I am a light-skinned African American. So being Black is not a privilege in this society, but I get more doors open than my darker skinned brothers and sisters because I am light. It's an advantage. See how complicated that is? I'm going to encourage you all, because you won't be able to do it today because we're almost at time, so that you can open up and start to engage with me in conversation, is I'm going to encourage you that you go home and you make a list of areas in your lives where you have privilege. And you mark E for earned and U for unearned. And then you also make a list of the areas in your lives where you don't have privilege. But in those areas, also put an A next to those where you may have advantages. And then you look at that and you wrestle with, how has that informed your lens, but how has that potentially also invisibilized your lens from seeing places in people's lives where they have to walk in this world very differently? That's why we pay attention to our invisible package of assets that we can count on cashing in every day. The way I usually conclude this is that there is this concept that was originally written to be funny, but has taken kind of a life of its own, which is, people have said back in the day, really, they don't say it much today, but they say, "Oh, why doesn't that person just pull themselves up by their bootstraps?" That's lathered in privilege. First, I always say, well, why do they have to have boots? Couldn't be flip-flops, sandals, let's diversify it a little. But the concept wouldn't fit, right? But in this concept of boots, that means that the person, first and foremost, need to have feet to put the boots on. So we've invisibilized some folks that have disability. And then they need to be able to get a boot. So we've invisibilized people with socioeconomic issues. And then we need to recognize that they need to have some instruction on how to put the boot on and how to lace it up and how to tie it, right? And so though it's used so frequently and easily to say, you just need to try harder, it's a beautiful example of how privilege has invisibilize this in the essence of what it really means. Let me keep going, and then we're going to open it up. You're going to see I'm going to just move past a couple of slides, not that it's because it's not important, but because of our time, and you'll be able to look at this. So you'll see ableism is listed here. Earlier, I also skipped past binary and I just skipped past neurodiversity. So please pay attention to those when you review them in your PowerPoint, because I need to just get to these last couple of pieces, which is our unconscious biases, which is again, the places in which we are not noticing how we're showing up in ways that create a lack of even-handed or fairness. Our unconscious biases impact how we see things, our perception. It impacts how we treat people, our attitude. It impacts our behavior, how welcoming or rejecting we are to people. It impacts what we attend to. It impacts what we hear. And it impacts how we comfort people. There is this thing called micro affirmations, which is how much or how little we comfort people in certain situations. I tend to say, who has the right to be comforted? In some instances, when we're not paying attention, our unconscious bias will have us comfort certain people and pathologize others. That's what micro affirmations mean. And then unconscious bias also shows up in microaggressions. And this is where I'll start to wrap up. And microaggressions, this is where we usually unintentionally, and it's subtle as the definition says, do things that feel hostile or demeaning to people of marginalized groups. And it can happen verbally, non-verbally, or environmentally. And the examples that I tend to give is it's so subtle that people will say, well, when can I or when shouldn't I say that? So for instance, I've had people say to me, well, you don't look like a doctor. I'm not quite sure what a doctor should look like, but clearly not me. Maybe I look more like a doctor when I put my glasses on. I don't know. Or you're so articulate. Not quite sure what that means. Or some of you may have experienced people saying, you're so beautiful, or you're so nice looking to be fat. Not quite sure where you're going with that, right? Did you go straight to a four-year college, or did you go to a community college first? See how subtle these are? Some of us even love it when people say, you do not look your age. What is that saying? Microaggressions are where you don't know if the person complimented you or slapped you. That's the microaggression, because you feel it. And at the same time, you're like, should I say thank you? And it is a microaggression also because it says something that you believe about that group, right? If I don't look like I should be a doctor, what is that saying to you about whatever it is? But I'm assuming initially you're saying something about my Blackness or about my braids or about something, right? So what does that say about that? If you think someone's beautiful because, and it's shocking you because they're heavier than what you think beauty should be, what does that say about how you see people in a particular light? That's the thing about microaggressions. We all do them, and we've had them happen to us. And then lastly, I'm going to say that the reason that we talk about unconscious bias is because they impact our work, and that in order for you to move through them, these are the steps that you would want to do. We started it first today by normalizing it, by having a conversation to say we do them. We all do them. And then to recognize them, this is external from you. It's for us to talk about what is unconscious bias. That's the anchoring, etc. That's recognizing, oh, okay, and it comes from privilege. Got it. Oh, and it can show up as a micro affirmation in our perception. It can be a microaggression. That's recognizing and identifying is in you. Now the job is, how does this show up in me? How do I do this? Then you have to be willing to explore it. And then you have to make a decision to do something. And that is a heavy lift because when you make a decision, there are reasons why we are attached to our unconscious bias. And in some ways, they're rooted in our identity and in our relationships. So when we make a decision to move beyond those biases, it also means at times having hard conversations, not only with ourselves, but also with people that we love. And then it shifts our lens. And I would love to say, once you know better, you do better. But we all know that's not the case. But what I can say is once you see different, you cannot then go back to unsee it. So then you are making conscious decisions to be biased because they're no longer unconscious.
Thank you, Dr. Carroll, and thank you all to who participated and were engaged today.
Thank you. Bye-bye.